When we're talking about rotator cuffs, everybody always asks, what have I done? Is it a muscle? Is it a tendon? Well, actually, this is a model here. What we have here is this is part of the arm bone. On the top of it is the ball, which kind of moves around, and here's the shoulder blade. Around it are these four muscles, and they basically join together like a cuff or a sleeve, on your arm. And so people ask, well, what have I torn? They say, I've got 2 tears or 3 tears. Well, what happens is that you don't see discrete tears. You see that the tendon, which is what joins every muscle to a bone, starts to rip, whether it frays or tears away, and then this muscle will start to pull back. And so when it does that, it stops being able to lift things up. It becomes painful. And then often what we have to do is pull that muscle back and find a way to stitch it into place so nature can do what it should have done to begin with, which is basically glue yourself back together. Well, the good news is not everybody has to have surgery. There are many people who have either tendonitis in their rotator cuff or partial tears, and often with a combination of therapy, medicines, time. Occasionally we'll do cortisone in a shot or a pill form. We can get them better, and they may go the rest of their life and never have a problem. Unfortunately, there are people where you do that, they don't get better, or they can't lift it up, or they hurt it again and it tears more. And in those cases, often we'll have to go in there and stitch the muscle back where it belongs, because it's sort of like a run in a woman's stocking. Once it happens, if you have a hole all the way through, it will get bigger, and you have to kind of darn it back together so that as you use your arm, it stays still long enough to do what it should have done to begin with, which is glue itself back together.